A lot of the couples who are coming, they are coming at an advanced age. And all of those women, the only viable option for them to have a healthy baby, to get pregnant in the first place, is through the third party program. All right. So, very quickly, we would move to the next fertility issue, and that is, can I access IVF care remotely? What I mean is that I am based in Lagos and you are based in Abuja. How can I access fertility care? It's possible. It's very, very possible. We are not yet located in other states in Nigeria. We are presently located only in Abuja, but we are trusting God that in a very short time from now, we will have offices in other states so that our patients can easily access our services. But before that happens, I want to say that we have taken special notice of some of the logistic challenges that couples would have who are not based in Abuja. And we've tried to mitigate these challenges through our treatment program that is specifically tailored to address these challenges. And so it's easy for patients to come from all over, practically. Because we have patients who come from all over the world, really, to access fertility care. Because the first thing that you must consider when you're looking to start your journey is that you must look for a center that works. A center where you have a very high chance of achieving conception. And that is why patients come from Australia, they come from the United States, from the UK, from Europe, to access fertility care. Are there no centers in those places? Of course, there are centers. But they consider a lot of factors and they make up their mind that it's better I come back home. And of course, we have patients from all over the country, from the north. Is to reduce that duration to as much as 1 to 2 weeks. But what that means is that you must visit twice. So the first visit is for fertility evaluation, where you will come and then we'll go through your investigations, have your scans done, do your mock, just really get to have a first encounter with you. And how long does that take? Practically about a day or so. We can have all of those things done within 1 day. So you can actually take a flight, an early morning flight, come in, have all of those things done, and then you go with the evening flight. For those of you who have very busy schedules. All right, and then we'll follow up via our online consultations. And then the second visit that will now take 1 to 2 weeks. But for this to happen, it means that we would have planned your program, first initial encounter with you, and then the program will start at your base, and then you come over and then you finish it. So for patients who have complained that, oh, I don't have that kind of time to leave my work, to leave my family, and travel and come and stay in Abuja, that has been taken care of. And what more, we provide accommodation. So even if you don't have any person in Abuja, that is not a challenge. We're able to provide you with accommodation, but for that, it's not free. It's also possible for the spouse to come in rather than come twice. For example, for some of our patients, those who are coming from outside the country, the man can come once, and we're able to go ahead with that program. And of course, if the semen parameters are fine, then we can go ahead and freeze the sperm. All right, so that makes it convenient that the man doesn't have to keep coming for the duration of the program. So this is how we are able to ensure that we we provide services even for those who are not based in Abuja. So you don't need to spend 4 to 6 weeks with all the burden of accommodation, feeding, and all of that. We're able to tailor your treatment to be as convenient as possible. All right. So we go to the next issue. This one is a very, very important one. Very, very important. How do I finance my fertility treatment? Unfortunately, we don't have healthcare insurance that funds fertility issues. And unfortunately, again, 60% to 70% of infertile couples will require IVF. So you see, a lot of the patients who have difficulty achieving conception, the mainstay of treatment is IVF. But unfortunately, it's very expensive and out of reach of many of these patients. So financing such a program becomes a huge challenge. So how do you go about financing it? Next slide. For us at the JOJE Abebe Fertility Center, we have a foundation, the JOJE Abebe Art Foundation, that provides some comfort and provides some help. And what we have tried to do is, in the past, we have provided a lot of discounted programs, which we are still doing right now. And for routine investigation, and what you need to pay was just for the hormonals. It included the technical fees, it included medications, all right? And you need to pay something extra if you were doing a third-party program. When it came out, a lot of people didn't believe that that program was possible. For a lot of people felt it was a scam, but it was real, and a lot of patients benefited. In fact, the first delivery from that program, that baby is a year plus already, a boy. It's a year plus already. More than over 250 babies have been delivered. All right, couples that have been impacted by that program, and that program is still on. That program is on for 5 years, so the program is still on, although it is not still 500 now, and I'm sure you understand why, because of the economic realities. All right, we wished it was everything remained the same, and it would have just been on, but we've had to adjust over time, over the last 2 years plus, the cost of that program. So, but again, even at what it is right now, it's still a very discounted program compared to the normal IVF cost. All right. So we provide those kinds of program. There's also a collaboration that we have with Access Bank. Okay, through Access Bank, you are able to access some facility to help fund the IVF program, and then you have very convenient payment plans, and then of course the interest rate is also not as high as what you have for the regular loans. And then we also introduced the JOJE IVF savings scheme, because a lot of patients had complained that they had difficulty being able to save up for their treatment program. So we said, okay, fine. You can pay in installments. We will provide you a special account where you'll be making your payments. And once you've made up your payment, then you can now start off your program. So these are all the options that we are providing. We're also exploring other options to try and see how we can further reduce the cost of IVF treatment. Last year we offered about 5 patients completely free IVF programs. All right, and I would say about 2 or 3 of them are already pregnant already, and they are carrying on with their pregnancies. We are trusting God that we will have more partners who will join us to further reduce this, because as it is right now, I would say that the burden, the major bulk of this program we are doing is being borne by the organization. But we're trusting that we'll have partners that will come join hands with us to ensure that we reduce the cost further from what it is. Okay? Okay, so before we gradually begin to round up, I'm sure many of you want to know this center, what is your success rate? You've been talking. Just be talking good grammar. What is your success rate? Because it's all about your success. All right? No matter how cheap a fertility program will be, if you don't have a good success, it's as good as nothing. You must have value for every kobo you spend for your fertility treatment. So, I'm going to be presenting to you our success for last year. The average success we had last year was 47.7% at the end of 2022. Now, the average success rate for our third-party program for last year was 56%. And then in one of our batch, we had a 75% success rate. If you ask me, I would say that we are not doing badly. This success rate is above the national average. We are not doing badly, but yet we are not resting on our house. We are trusting God that we would do better with our success, and to God be the glory, we are doing well. This year we are currently doing a 51.5% average success. By this time last year it was about 36-37%. So with the projections that we're having, we are hoping and we are trusting that we should do above 65% average success this year. And with God, all things are possible. So I'll say that our success is not bad, and so it's a good rate, and we'll constantly will be hoping to improve on our records. So how can I start my journey to parenthood? Because it's a journey that must be started. So I'll say the first step that you must take is to look for a good fertility center. And that is why I welcome every one of you who's listening to me right now, who have not yet begun this journey, who have not yet decided on a center to use. I welcome you to the JOJE Abebe Fertility Center. It's a center where we are driven by passion and a commitment to excellence to ensure that every couple who's trusting God to be blessed with the fruit of the womb have their heart desires met. Haven't gone through this same experience myself. Haven't gone on this journey myself. We are positioned to ensure that we provide cutting-edge services to ensure that we meet your heart desires. The second step is to make necessary inquiries. Don't just take my word for it. Ask questions. Make a phone call. Visit our website. All right? Come to the clinic for those of you who are in Abuja. Or if you're traveling through Abuja, come visit us and see what we're doing. All right? And then the third step is to begin to make plans. A man who fails to plan has planned to fail. Make plans, financial plans, psychological, spiritual. You need to be prepared for this journey, because a very good preparation will ensure that you end your journey successfully. And then the fourth step is to call. Call us. Schedule an appointment. We have online consultations, meaning that from any part of the world that you are, you can have a consultation with one of our fertility specialists. And then once you have done that, you have taken that first step towards your journey to parenthood. And we believe that you take further steps until you achieve success. Okay? So when do I start? Start now. Start now. Don't delay. You see that phone number on your screen? Call. Call that number from 9 a.m. to 5 p.m. Mondays to Friday. Someone will pick that call and will give you all the necessary information that you need. Visit our website. Visit the fertility website at jojefertility.com.ng, or you visit the foundation's website at jojeabebefoundation.org, and you would have begun your journey to parenthood. And I have no doubt in my mind that as you take that first step, you will ultimately achieve your goal. And we'll be glad to say congratulations at the arrival of your bundle of joy. So thank you very much for the attention. At this time, I would like to take questions. And that's after we are back from a very short commercial break. See you in a bit. Are we on commercial now? I can talk.
Thank you for registering. You're welcome. My name is Elizabeth Wachku. I'll be giving you a brief but detailed information about JOJE Fertility Center, JOJE Art Foundation, and Be Fruitful Project. JOJE Abebe Art Foundation is a non-profitable organization. Our mission, among other things, is to be a support system to couples who are trying to achieve conception and ensure that they become joyful parents. We hope that through our discounted art services, in collaboration with JOJE Abebe Fertility Center, many will be inspired and motivated, encouraged to start this journey to parenthood, which because of high costs may have refused to start at all. The vision that founded JOJE Abebe Art Foundation was born out of a personal experience, having dealt with the burden of infertility for 13 years. Before having our babies, we understand the difficulties associated with infertility, especially the high cost of treatment, which has made many couples to close the chapter of human reproduction and have accepted infertility or barrenness as their fate or lot in life. Therefore, our vision is to provide a support system that facilitate the journey to parenthood, and our mission is to provide all the necessary support to couples trying to achieve conception. What do? We make fertility treatment affordable to infertile couples who can't afford it through financial discount. We create awareness about the available treatment option for infertility through a special educational program. We also provide the much needed psychological, emotional, and spiritual support to our clients before, during, and after the treatment. Offer free fertility counseling and consultation services. Stages of journey to parenthood: fertility treatment stage, pregnancy stage, post-pregnancy stage. Being challenged in life is inevitable. Being defeated is optional. Ruga Ruford said that. Listen to some of the beautiful success stories of our clients who have waited for years but received their bundle of joy through the Be Fruitful project and be inspired. Let hope rise within you. Pregnant for the past 12 months and unable to conceive after? Don't worry, we have good news for you. Do you know, here at JOJE Abebe Fertility Center, we have over 260 couples who have been confirmed pregnant from the Be Fruitful project and are currently on their way to parenthood. Do you know, with IVF, you can overcome unexplained infertility. What are you still waiting for? Kindly register and have a consultation with their specialist. You too will carry your own child. You can reach us by registering on our website, jojefertility.com.ng, or give us a call or WhatsApp on 080 69 01 91 77. See you soon.
You're welcome back. So we're going to be taking some questions, all right, from our audience. Those who have sent in questions, we'll take them, and I'm sure that we'll be able to answer most of your queries. So we'll be taking the questions. Please, so you listen to the first question, and then we'll take them one by one. All right. So let me say thank you to all of you who have sent in your questions. And if you are currently listening and you've watched this program and you want to send in a question, you can quickly just type it and send it. Okay, and then we'll be able to take it. All right, so let's have the first question.
How can a woman with hydroponics,
Hydrosappings.
hydrosuffix, PCOS, ovarian cyst, high prolactin, and Asman syndrome achieve a successful IVF?
Wow. All of these are inside one patient. That is a whole lot. So a woman that has hydrosappings, that has PCOS, has ovarian cyst, has Asherman's syndrome, and then is asthmatic. Wow. Well, let me first of all say that it's going to be very challenging, but it is mission possible. So what will happen is that one by one, each of those issues will need to be addressed. Hydrosappings means fluid in the tubes. That can affect IVF success. So what needs to be done is that those tubes need to be taken out. All right, so that the woman does not stand the risk of having fluid in her womb that will affect implantation. Number two, the woman that has uterine synechia, I discussed it when I was doing my presentation. Synechia means that the womb has come together. That woman needs to go through a surgical procedure called hydrolysis to separate the womb and keep it open. All right. If that is done successfully, then she can go ahead and carry pregnancy. And then the third factor you mentioned was PCOS. Again, I mentioned that as one of the factors that causes anovulation, the inability of the woman to ovulate. Now, this depends on her age. Her age was not mentioned. If she's less than 35, then there's a good chance that she can use her eggs, and then she will be able to achieve conception. But if she's above 35, well above 35, then the quality of the eggs would be a challenge. Yes, she will have eggs, but the quality will be a challenge. And then we'll also have to now be able to overcome the risk of ovarian hyperstimulation which can occur. That we're able to deal with by picking the most appropriate stimulation protocol. And then the last factor was asthma. Well, that is a medical condition which I'm sure we'll be able to manage and then take her through the treatment program. All right. So it's going to be difficult, but I think it's mission possible. Let's not forget, you also mentioned ovarian cyst. The cyst will have to be dealt with because you can't have a cyst and go through a stimulation program. The cyst will have to be resolved. Okay. So the next question.
Is it possible for someone with azoospermia to use his sperm during IVF?
someone with azoospermia using his own sperm. Azoospermia means that there is no sperm cell in the ejaculate. When a man produces semen, there is no sperm cell at all. And if that is the case, it means that IVF cannot be possible because there is no sperm cell. However, if the azoospermia is obstructive, what I mean by that is the testes are producing sperm, but as a result of the blockade in the tube, the sperm cells is not getting out. So when you do your semen analysis, you don't find any. So with invasive procedures like TESA, which is testicular sperm aspiration, we are able to go into the testes or the epididymis to aspirate the stored sperm or the sperm that is in the testes, and we can, through ICSI, in vitro fertilization, we will be able, sorry, intracerebral sperm injection, we'll be able to achieve fertilization. We can go ahead and do IVF, but not the conventional IVF. With the conventional IVF, we will not be able to achieve a good outcome. But if it is non-obstructive, in which case the testes are not producing sperm at all, then it becomes a very difficult case. And unfortunately, the most viable option at that time will be to use a sperm donor. All right? Great. So the next question, please.
Can I get pregnant through IVF without removing the fibroid outside my endometrium?
Yes, if the fibroid is outside your endometrium, then you can go ahead and do IVF without having to take out the fibroid. But if the fibroid is very close, distorting, or inside the endometrium, then the fibroid will have to be taken out. All right, so next question.
I have done most tests to the point. I have done most tests to the point where the egg and the sperm was seen through TV scan, but conception does not take place. What is the cause? Also, for the past 6 months, my period has not been regular.
So you've done most tests where the sperm and the egg were seen
Through TV scan.
through transvaginal scan.
Yeah.
You can't see sperm through transvaginal scan. So what I'm sure the question is that we've done transvaginal scan. So they probably did follicular tracking to see if the woman will produce eggs, and there was evidence of follicular growth. Okay, and so if timed intercourse was done and there was no fertilization having after having evidence of ovulation, then there are so many factors that can make that not to happen. All right. So what I would advise is that if that is the case, then the couple should consider going for IVF. All right. The couple should consider going for IVF. If you have done timed intercourse, if you have done IUI, in which case the sperm was injected, prepared sperm was injected into the uterus to achieve conception, fertilization, and it didn't succeed, then I think the best option would now be to go for IVF. All right. Next question.
I am 58 years old, a teacher. How can I pay for it, being a salary earner? What What is my chances?
A salary earner, you're a teacher, and that is why I would advise that you call and you go through the IVF savings scheme. All right, the IVF savings scheme, because you would need to save up for you to be able to assess treatment. That is the best option. And the truth of the matter is this: for couples who require IVF to get pregnant, whether you do the IVF this year or you do it in 2 years' time, you still need to do the IVF to achieve conception. So it's just like a building. You prepare. If you have a building project you want to embark upon, you need to make plans, you need to prepare. That is what it is. That is how it is. And that is why we have provided that IVF savings scheme to help couples to be able to save towards that program. And as you keep saving, God, who knows what you are planning for, can surprise you and make provisions available from sources you did not expect. Okay? Next question.
Okay. I'm 47 years old and my menses stopped flowing for the past 5 months. What are my chances?
Okay. 47 menses have stopped flowing for the past 7 months. So what I would say is that it's possible that that woman is getting close to menopause. She is in a climacteric period. Okay. Now the best option for you, you can get pregnant, but the best option will be the use of a third party.
My question is what kind of supplements will be taken for a successful IVF?
Supplements supplements have limited roles in the success of IVF. So if for the man there is poor semen parameters, usually will advise them to take supplements that contains multivitamins, like the proceeds, the vitamin, fertility, men boosters, all of that. There are a lot of supplements that contains a lot of vitamins. All right, those are okay for the men. For the women, yes, there are supplements that are usually prescribed: Overboost, Fertility for women, Proxy for women. All right, Fertility. All right, but all of these, like I said, it has limited success. They are more helpful in women that are less than 35, and they are not really very beneficial for women who are above 35, particularly those who are in their late 30s and into their 40s, because of the age factor. All right.
Is there provision for us, for those of us who are not financially buoyant but desire conception via IVF?
That's what we talked about the treatment, the fruitful program that we are currently running. Everything has to do with planning. You're not financially buoyant. Nobody keeps 1 million at home and say, I want to use this to do IVF, and it's just there readily. You have to plan for it. Whatever it is that is needed, I believe that as you begin to plan and save towards it, additional help will come. All right? Additional help will come. And I believe that there are many, many, many such couples who have gone through that route, who saved up, who planned, and they came and they were successful. All right. So I believe very strongly that you will also be very successful as you take those steps towards making plans, saving up for it. We have a lot of our patients who right now are saving up, okay, to embark upon this journey. So I think it's just for us to be able to start saving.